Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and I'm here to guide today's discussion on an issue that affects nearly 1 in 4 adults worldwide, fatty liver disease. Joining me is my co-host, Alara Sky, who brings a wealth of insights on natural health approaches. Today, we'll explore the ways fatty liver disease can silently develop and the serious risks it poses, along with practical steps for better liver health.
Thank you, Ethan. Fatty liver disease is a growing concern because of how common it is. About 25% of adults worldwide have it, often without knowing. When fat starts to accumulate in your liver cells, it creates inflammation that gradually damages tissue. Over time, that damage can lead to cirrhosis and heighten your risk of heart disease, type 2 diabetes, and even liver cancer. Early detection and intervention are critical, since symptoms may be unnoticeable at the onset.
Even though it's called fatty liver, the root of the condition goes beyond just fat buildup. It's connected to metabolic issues like insulin resistance, which can lead to a wide range of health problems. Recent findings even show that fatty liver disease increases mortality rates from causes linked to endocrine function, infections, and other conditions that stretch beyond what we'd typically assume.
Precisely. A study in the Journal of Hepatology highlighted how individuals with fatty liver disease face significantly higher death rates, notably from endocrine-related disorders. Hormonal imbalances and pancreatic or thyroid dysfunction became considerably more dangerous when coupled with fatty liver. An interesting outcome was that while mental health mortality risks did not greatly increase, other chronic conditions, such as certain infections and gastrointestinal problems, did. These data points suggest that once the liver is compromised, it contributes to a domino effect on multiple organ systems.
Another key point, as the study revealed, is that people with more advanced cirrhosis, permanent scarring of the liver, were at higher risk for non-liver causes of death as well. This underscores how damaging cirrhosis can be to overall health. And perhaps most important, mortality risk is especially high during the first year after diagnosis. That means it's crucial to address the condition as soon as you're aware of it. Early steps, such as changing your diet or adding exercise, can make a significant difference.
Yes. And a separate study in clinical molecular hepatology further confirms that fatty liver disease isn't just about the liver. Cardiovascular disease, for example, is a leading threat for people who have this condition. Even though we associate fatty liver with cirrhosis, research shows that heart attacks, strokes, and other vascular complications are often a bigger risk factor for mortality. These findings stress the need to consider heart health when dealing with liver issues.
Also, once someone has advanced liver fibrosis, the stakes become even higher. The scarring diminishes the liver's capacity to handle toxins and regulate metabolism, which means the body may find it tougher to fight off other illnesses. This chain reaction is magnified if there are genetic variants like PNPLA3 that accelerate the accumulation of liver fat, and low or borderline thyroid levels can further add to the risk by slowing the body's metabolic rate.
Muscle mass is another key element. Sarcopenia, or muscle loss, is associated with increased mortality in individuals with fatty liver disease. Building and maintaining lean tissue helps your metabolism handle glucose properly, which can reduce insulin resistance. If your muscle mass declines, it becomes harder for your body to burn fat and keep inflammation in check. This is why resistance training or other muscle-building activities are so valuable for anyone concerned about liver health.
That's a good segue to talk about practical strategies for those already living with fatty liver disease, or for people aiming to prevent it. First off, the best dietary move is to cut out ultra-processed foods and added sugars, particularly fructose and sweetened beverages or snacks. Studies suggest that excessive fructose consumption prompts your liver to create new fat through a process called de novo lipogenesis. Over time, that can lead directly to fatty liver, even if you don't drink any alcohol.
Exactly. And fructose is not dangerous in natural forms like whole fruits, because the fiber and other nutrients help the body process it at a more manageable rate. What poses the real threat is refined fructose in sugary drinks and processed foods. This overworks the liver, encourages insulin resistance, and limits the body's ability to burn stored fat. As a result, the liver becomes increasingly overloaded with fat, pushing you closer to serious conditions like type 2 diabetes or cardiovascular issues.
On the lifestyle front, consistent physical activity is crucial. A half hour of moderate intensity exercise most days of the week can do wonders. It helps your body utilize fat more efficiently, supports insulin sensitivity, and has a positive effect on many metabolic pathways. In tandem with a better diet, this is one of the most direct approaches to curbing liver fat.
And if you're overweight, even a modest weight loss, around 7% to 10% of your total body weight, can significantly reduce liver fat. Pair that with resistance training sessions a couple of times per week to build or maintain muscle mass. This approach not only keeps your metabolism steady, but also lowers systemic inflammation. All these changes combine to preserve proper liver function and reduce your odds of serious complications down the line.
One more piece of the puzzle is addressing any underlying metabolic conditions like prediabetes or insulin resistance. Keeping an eye on carbohydrate quality makes a difference, opting for whole food carbs over refined sugars. When we manage blood sugar more effectively, we relieve some of the pressure on the liver and limit fat buildup.
That covers the essentials of prevention and treatment. For listeners who want the big picture, fatty liver disease starts silently, but can escalate quickly if it isn't managed. Once it becomes advanced, there's an increased risk for cirrhosis, heart disease, endocrine disorders, and more. This is why interventions, especially early on, are so important.
Before we wrap up, let's address some frequently asked questions about fatty liver disease. First, what exactly is fatty liver disease and why is it a concern? The answer is that it's a buildup of fat in the liver that triggers inflammation and scarring. This can result in significant risks, including heart disease and endocrine issues, increasing overall mortality.
The second question is, what are the common signs? In early stages, symptoms are minimal or absent, making it tough to catch. As it progresses, though, fatigue, abdominal discomfort, and unexplained weight loss become more apparent. Those signals mean you should look into screening and consider lifestyle adjustments right away.
Another question is how fatty liver disease affects the body beyond the liver. We've touched on it already. It raises the risk of cardiovascular problems, certain cancers, and endocrine imbalances. The chronic inflammation it sparks puts stress on multiple organ systems, resulting in a higher vulnerability to various illnesses.
Yes, and people often ask, what lifestyle factors make fatty liver disease worse? Excessive fructose intake in processed foods and drinks is a major trigger. Obesity, lack of regular exercise, and insufficient muscle mass also accelerate fat accumulation in the liver. By focusing on a healthy diet and staying active, you reduce these compounding factors significantly.
Finally, there's the question of how best to reverse fatty liver disease. The approach is multifaceted. Start with a diet of whole, nutrient-dense foods. Exercise regularly to improve metabolism and lose extra weight. Build and maintain muscle mass through resistance activities. And correct any metabolic issues like insulin resistance. Acting early makes a major difference in outcomes.
That sums up the core information we have today. Fatty liver disease is common, but it's not inevitable. With practical dietary changes, consistent physical activity, and attention to metabolic health, you can prevent or reverse much of the damage. We encourage anyone concerned about their liver health to consider these steps and get the process started sooner rather than later.
Thank you, Alara, for sharing these insights. And thank you to our listeners for tuning into this episode of Dr. Mercola's Cellular Wisdom. We hope you found this discussion on fatty liver disease both direct and informative. Remember, small mindful changes can have a considerable impact on your overall health. Take care, and we'll be back soon with more key findings to help you live better.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.